Who is the person you love most in your life? Now, imagine that person coming to talk to you. You see the face, but fail to recognize who that person is. A glitch in the brain suddenly took your ability to recognize the faces. As soon as they speak, you can recognize them with their voice. This is the case with face blindness, which is scientifically known as
Prosopagnosia.
There are instances where people have failed to recognize their reflection in the mirror. Facial blindness can be associated with an inability to recognize some familiar objects. Some people may not even recognize their car. Do you want to know how this brain glitch occurs? Let me simplify this for you. The occipital cortex of the brain is responsible for the perception of visual information. The signals generated by the eyes are carried by nerve tracts to the occipital cortex. Then, this information is relayed to the fusiform area of the temporal lobe. The fusiform area computes this information and tells you to whom this face belongs. In patients with prosopagnosia, eyes, nerve tracts, and occipital cortex are intact, but they have a defective fusiform area. The functions of the fusiform area can be disturbed by tumors, strokes, multiple sclerosis, and even congenitally. Okay, let me also tell you about a similar disorder. Imagine you are walking along a road and you come across a fire hydrant, but you see it as a face of a beloved person. This illusion of seeing faces in other objects is called pareidolia. This can happen when the fusiform area mistakes the shadows and other details of the object for facial features. For most people, this illusion is only benign. Do you see faces in these pictures? Don't worry, this is only a benign brain glitch. Let's get back to facial blindness. It is also interesting to know how neuropsychiatrists diagnose prosopagnosia. They will test the patient's ability to recognize famous people, judge facial expressions, and memorize and recall unknown faces. An ophthalmologist will check the eyes to exclude vision problems. A neurologist will perform a full neurological examination to detect focal signs. Brain imaging will be used to rule out sinister causes. Unfortunately, there's no specific treatment for prosopagnosia. Most patients rely on other details like the voice, clothes, or the walking pattern to recognize people. Treating the underlying cause may lead to recovery in some patients. For others, there are therapies to improve facial recognition.
Hope you liked our video. Share this information with your loved ones. And don't forget to subscribe to our channel. Thank you.